Hey everyone, I hope you are doing well. Welcome back to the channel. My name is Aryan Malik and this is Study With Me series. Today it's part 3. We'll be going over some drugs and this will lead to the conclusion of the drug series. The next drug is levothyroxine, which is also called Synthroid. It's a thyroid hormone and it's given in patients who are experiencing hypothyroidism, meaning low thyroid, or Mike's edema, or also patients who went under thyroidectomy. The best time to give this medication is empty stomach or before breakfast to prevent insomnia. The patient teaching for this medication will be to monitor for pulse rate before taking the medication. It is very important. And if the pulse is 100 or more, the patient should hold the medication and notify their doctor. And high pulse rate means the patient is leaning towards Graves' disease. And if a patient taking this medication says they are having chest pain, tachycardia, or insomnia, it is leading towards hyperthyroidism, meaning high level of thyroids. In that case, we'll be notifying the physician. And one thing about to know about this medication is that it stays lifelong. It will not be stopped. Like if a patient says, "Oh, I'm feeling better, can I stop this medication?" As a nurse, our responsibility will be to make sure they are in touch with their provider, and this medication usually goes lifelong. The next medication is Carbamazepine, also called Tegretol. It's a seizure medication. Its side effect is photosensitivity, meaning the skin is sensitive to light, and it's used in trigeminal neuralgia, or also called tic douloureux. So what is that? What is trigeminal neuralgia? It's painful sensations similar to electric shock on one side of the face. And if a question asks like what cranial nerve is affected, it will be fifth cranial nerve is affected during trigeminal neuralgia. The patient, as a nurse, we recommend that the patient do not eat on the same side. So if they're facing pain on the right side, we recommend eating on the left side. That will help with the pain. At least they will not feel that pain. And um, doctors usually put them on a soft diet, which means the food neither should be too hot or not too cold. And what we are trying to do is we are trying to prevent any stimulations because it's very painful. So any stimulation can lead to pain. For example, cold air. We also want to make sure that no cold air is flowing in the room. And the next drug is aluminium hydroxide. It's also called Amphojel. It's an antacid and it's a GI medication. It's usually used when the patient has ulcer or GERD. And its role is it neutralizes the hydrochloric acid. It's usually given before bedtime. In medical terms, that is referred as HS. 1 hour before bedtime is referred as HS. In while giving this drug, we monitor for constipation. It's a side effect of this drug, and again, it's responsible also for reducing pepsin activity. So pepsin is happens after digestion, and it can cause some problems if a patient is experiencing ulcer. This drug reduces the pepsin activity, and the next drug is Isoniazid, or also called as INH. It's a TB medication, and its side effects is that it causes peripheral neuropathy. In order to prevent peripheral neuropathy, we are administering pyridoxine, which is vitamin B6, and If untreated, the peripheral neuropathy can lead to rash or urticaria, which is also called hives. And before giving this medication, we are monitoring liver. So basically, as registered nurse, we are assessing the liver functions. We are seeing if the liver is in normal size. We palpate the liver and ask the patient to take deep breaths so that we can know that okay, the liver is in normal condition. As we might know, TB medications are given for a period of 6 to 9 months. Sometimes it might show up as 6 to 12 months. So either of them is correct. Now, I would like to take a dive into vitamins. What are some important vitamins? Thiamine, also called vitamin B1, it's responsible for carbohydrate metabolism, and its deficiency will lead to beriberi, or as some call it, mental confusion. The next drug which we discussed was pyridoxine. It's vitamin B6 and it's responsible for metabolism of amino acid, and its deficiency will lead to anemia and seizures. The next drug is folic acid. Not drug, my apologies. It's vitamin folic acid. It's responsible for RBC formation, and its deficiency will lead to anemia. The next vitamin is cyanocobalamin. It's vitamin B12. It's responsible for nerve function, and its deficiency can lead to pernicious anemia. Vitamin C, it protects cells, and its deficiency can lead to scurvy, or as we say it, gum bleeding. The next vitamin is niacin, vitamin B3. It's usually found in peanuts, peas, beans, meat, and anything poultry. Its deficiency can cause pellagra, which can lead or show up as rashes around the face, around the mouth, on the body, and it can also cause depression and constipation. So, deficiency of vitamin B3 can lead to depression and constipation. Last is vitamin D, which we receive from sunlight, milk, and fish. Its deficiency leads to rickets in children and osteomalacia. I hope you like this series. This marks the conclusion of the drugs. Tomorrow I'll be going over fluid and electrolytes. We'll be starting a review on that. If you have any questions, please feel free to use the comment section. Thank you for watching.